Good afternoon, realtors, and thank you for tuning in today. Joining us today is Torri Toland and Leslie Coolidge from the South Carolina Department of Health and Environmental Control. Torri Toland has been with DHEC in the Bureau of Chronic Disease of Injury Prevention, Division of Cancer Prevention and Control since March of 2018 as a Policy Systems and Environmental Change Senior Consultant. Leslie Coolidge has been with DHEC in the Bureau of Air Quality since 2004 and has managed the South Carolina Radon Program since 2018. Thanks for joining us today, and now I'm going to turn it over to you.
Okay, thank you so much, Michael, for introducing Leslie and I on today. And thank you all out there for joining. We'll go straight into the presentation on today, dated January 20th, 2022. First of all, the presentation today we'll be discussing is on radon, lung cancer, and real estate. Talk a little bit about the Division of Cancer Prevention and Control, which consists of my boss, Sonia Younger. She's the program director for Comprehensive Cancer Control Program, and myself, Torri Toland, the senior PSC consultant. To tell a little bit about who we are and what we do in the division. We're the public health division within the Bureau of Chronic Disease and Injury Prevention within the agency. We promote and collaborate to implement evidence-based population health intervention, prevention and control strategies to reduce the impact of cancer in South Carolina. Our initiatives are data-driven with a focus on the top 10 screenable cancers, especially among underserved populations. We utilize federal and state funding to support and build partnerships at the state and local level to address the burden of cancer. We coordinate the development and implementation of the South Carolina Cancer Control Plan 2017 to 2022 and the 20-year data report in collaboration with the South Carolina Alliance and South Carolina Central Cancer Registry. The objectives for today, we'll explain what radon is, we'll provide radon and lung cancer overview, we'll describe radon testing and mitigation, and we'll explain how realtors can help prevent lung cancer via real estate transactions. What is radon? Radon is a naturally occurring radioactive gas. It's colorless, odorless, and tasteless. As a result from the natural decaying of uranium in the soil, is present in nearly all air, and everyone actually breathes in radon every day, usually at very low levels. Here's just an example shown. Radon can easily enter your home through foundation openings. When it enters your home, a home acts like a vacuum, drawing gases inside and trapping them. Driving force is from negative pressure. What is radon? Radon is actually factors contributing to the radon level in your home, including the amount of uranium in the soil, how porous the soil is, and how the home is built. Basement and first floors typically have the highest radon levels because of the closeness of the ground. Radon can actually be released from building materials or from water obtained from wells that contain radon. It has no immediate health effects. Radon actually has no symptoms, and the radiation damages lung cancer and DNA, lung cells and DNA. Radon decays quickly, giving off tiny radioactive particles. When inhaled, these radioactive particles can damage the lining of the lung. Long-term exposure can lead to lung cancer. Lung cancer is the type of cancer that starts in the lungs. Cancer starts when cells in the body begin to grow out of control. Cancer can begin in the lungs and may spread to lymph nodes or other organs in the body, such as the brain. Smoking causes most lung cancers, but non-smokers can also develop lung cancer. Radon exposure is the second leading cause of lung cancer. Some of the symptoms of lung cancer is a cough that does not go away or gets worse, chest pain that is often worse than deep breathing, coughing, or laughing, hoarseness, unexplained weight loss or loss of appetite, coughing up blood or rust-colored saliva, shortness of breath, feeling tired or weakness, infections such as bronchitis or pneumonia that don't go away or keep coming back, and a new onset of wheezing. The public is generally unaware of the increased risk of lung cancer related to radon exposure, with smokers more at risk for radon, including lung cancer. At this time, I'll turn the presentation over to Leslie Coolidge, our coordinator for the South Carolina Radon Program of Bureau of Air Quality. Leslie, the floor is yours.
So hello, and thanks very much for having us today to talk about radon. And I just want to make sure everyone can hear me. Can you hear me, Torri? Okay, good. Okay. I guess I just wanted to make sure Torri could hear me. So on this first slide, oh, I guess we skipped a slide. That's fine. So the South Carolina Radon Program promotes awareness of radon and specifically radon testing and mitigation. We have a program where we offer a free home radon test kit to homeowners, but these are not for use during real estate transactions. We have a lot of resources on our website, and I guess I did include it on that slide down below, scdhec.gov/radon. So we have information specifically for home buyers and sellers, links for finding qualified radon professionals, information on maintaining radon mitigation systems, and just a lot of other radon information and resources on our website. We have a 1-800 number for radon questions, and we sponsor trainings. We've sponsored several put on by Kansas State University in the last few years, and we're open to partnering on a radon and real estate continuing education webinar if there's a local realtors association would be interested. Kansas State offers a half-day course. I'm not sure of the CEUs with that, but anyway, if that is something that anyone is interested in, please get in touch with us about that. And Torri, can you go to the next slide? Okay, this map shows initial tests done by South Carolina homeowners using our free test kits. It's kind of fuzzy. This map is also on our website. It looks a lot better there. The darkest counties on the map are the ones that have done the most testing. The white county haven't done enough testing to get a pie chart. The red color represents tests at or above EPA's action level, which is 4 picocuries per liter. At this level, EPA recommends that mitigation be considered. The yellow-orange color represents tests between 2 and 4. Because there's no level of radon that's considered safe, EPA says at this level, homeowners still may want to consider mitigation. The green represents tests below 2 picocuries per liter. There is no recommendation to consider mitigation at this level. A house can't be assumed to have a low radon level just based on the county. Can you go to the next slide, Torri? There can be a big difference between homes that are right next door to each other. Testing is easy and inexpensive, and it's the only way to know your radon level. And next slide. As I mentioned a few slides ago, EPA recommends mitigation at or above 4, recommends that homeowners may want to consider mitigation between 2 and 4, and says that most homes can be brought to 2 picocuries per liter or lower through mitigation, but a level of 0 is not possible since there are low levels of radon in the ambient air. Next slide. EPA recommends that home sellers test their home before putting it on the market and mitigate if the radon level is high. And we do see some people who address radon in advance. You all may have seen that too. If a seller knows there's an issue with radon, they have to disclose it. Buyers can request a radon test, even if the seller has previously tested. The standards of practice for radon measurement state that testing associated with a real estate transaction should be done by a qualified radon measurement professional. These standards were developed by the Association of Radon Scientists and Technologists and accredited by the American National Standards Institute. And they can actually be viewed online. This is a relatively new thing, but there's an entire suite of standards for different types of buildings, for mitigation, for measurement, for new construction homes. And you can flip through all of them online from that website there, standards.arst.org. And they're pretty simple to look at. They're working documents, so they can really be a good resource for anyone. There are only 2 certifying organizations for radon professionals that are accepted by EPA and listed in the standards. Those are the National Radon Proficiency Program and the National Radon Safety Board. Our website has links to their websites where currently certified professionals are listed. So it's easy to verify whether someone is certified. Home inspectors can offer radon measurement services without being certified in South Carolina, but working with a qualified certified professional can help ensure that the testing is done correctly. That said, some parts of the state don't have any local radon professionals. The NRPP recently started a certification program for technicians who work under a certified professional. We don't have any of those in South Carolina yet, but I'm hopeful that it may be that qualified radon services will be more available throughout the state in the future. And you can go to the next slide. Yes, okay, real estate testing protocols. So the first 4 bullets here apply to all testing. You want to test where you breathe, since the risk from radon comes from breathing in the decay particles from the decay products from the gas. You want to test under closed house conditions, which means that the doors and windows are closed for 12 hours before the test starts and for the duration of the test. There are a number of requirements regarding the placement of test. Guidelines include a prescribed distance from exterior walls, doorways, and vents. Some rooms are not suitable for radon testing, including kitchens, baths, and closets, and stormy weather should be avoided. And the test needs to run for at least 48 hours. There are additional protocols for real estate testing that are listed in the measurement standard. While a homeowner can test the lowest area that they occupy, for real estate, the lowest area that could be lived in should be tested. A homeowner can use one radon test. For real estate testing, either a continuous monitor or 2 short-term test devices are used. One of the things that a professional will do is make sure that the test conditions are as they should be. They take precautions to ensure that the test is not accidentally compromised or tampered with, and note any conditions that may have affected the results. The standards have guidance on interpreting the results when they disagree. And basically, if one of the test results comes back below the standard of 4 and the other one comes back higher, as long as they are not, as long as the higher result is not double the low result, then you can go by the average of the 2 tests. At 4 picocuries a liter or higher, the standards state that the home should be mitigated for radon. Next slide. Okay. Soil suction or active soil depressurization is the most common method of mitigation. This system uses piping and a fan to draw soil gas from beneath the foundation and exhaust it outside the home. An effective system depends on good pressure field extension, meaning that the soil gases are vented from throughout the footprint of the home. And thorough sealing between the collection system and the home is also essential. Just as for measurement, there are standards for mitigation, and qualified contractors can be found through the National Radon Proficiency Program and the National Radon Safety Board. The picture on this slide is actually a passive radon system that would be found in a new construction home. It's the same as an active system that would have a fan. Pressure field extension is ensured by a bed of gravel underneath the slab. The radon system is sealed off from the living space with plastic sheeting and caulk. And up in the attic is a junction box where a fan can be added if needed. Passive systems like this one are required in new construction homes in Greenville County, and you sometimes find them in other South Carolina counties as well. Next slide. So this slide shows our radon mitigation checklist for homeowners on the left, and that's on the Radon Program website. And on the right is a picture of the cover of the mitigation standards for homes, which is at standards.ars.org. Just to give a few items from the checklist, which pretty much mirrors the standard. The exhaust system needs to be located where it won't potentially cause a health hazard. The vent pipe needs to be labeled so it doesn't get mistaken for plumbing. And a warning device is needed to alert the homeowner if the system isn't working. And so those are just a few of the items that are covered on this checklist and also in the standard. Next slide. So this is the last slide on mitigation, and I just included this picture here to show the radon pipes coming up the exterior of the home, which is also fine and something you may commonly see in a home that is being retrofitted with a system and it wasn't in when the home was built. Mitigation can be handled by the seller or the buyer. The buyer may be more concerned about things like effectiveness, aesthetic considerations, and operating cost. So they might want to be involved in choosing a contractor and making decisions about the system. In terms of mitigation system maintenance, it's very simple. We've taken from some EPA materials a little fact sheet that's on our website about mitigation system maintenance. It doesn't cover a whole page. Basically, the fan in the system needs to run 24/7. The homeowner should monitor the system and the warning device just to make sure it continues to function. And you may or may not be able to hear the fan operating. And it's important to retest every couple of years. And our program can provide a free test kit every other year for homes that have been mitigated. And one more slide, if you could advance to the next one. This is a picture of our free test kit postcard. On the bottom left, our web address is circled, and you can go there to request a free test kit. And on the right is kind of a picture of the test kit instructions and what the test kit envelope looks like. So we encourage everyone to test their home, and any South Carolina resident can request a free test kit from us. That includes real estate agents, people preparing to sell, and new homeowners. They're just not to be used actually during a transaction. And I just wanted to point out, with January being National Radon Action Month and with the pandemic, it's possible that some people will go to our website and try to request a test kit and get an out of stock message. So if that happens, please wait a while and try back. We are always offering these kits. So thanks very much for your attention, and I'll hand it back to Torri.
Okay, thank you so much, Leslie, for that. Okay, here we'll talk about radon and real estate professionals. The ask that we at DHEC here ask, we ask that you make it your policy to promote radon testing in homes among buyers and sellers. we ask for a recommendation of home inspectors who are nationally certified in radon measurement. This is just an example of the ask. I'm buying a house. Should I have it tested for radon? It's just an EPA recommendation that all houses, regarding of what radon zone the house is included in, be tested for radon. And I think Leslie shared that in her presentation. The ask, help. My client has high radon levels in their home. What should I tell them to do? The good news is the radon reduction techniques work well. Recommend that your buyers, sellers to obtain an estimate and reference from one of the qualified radon mitigation professionals. And as Leslie shared also, the website for that. Resources. Radon Resources is the South Carolina Radon Program, and we have the websites there for you. Environmental Protection Agency, the National Radon Program Services, National Radon Proficiency Program, the National Radon Safety Board, and the ANSI AARST Radon Standards, and the websites are provided there for you. Lung cancer resources can be found at the Centers for Disease Control and Prevention, CDC Lung Cancer, and the website's there at www.cdc.gov/cancer/lung. And also in the chat box, there are lung cancer fact sheet links that you can download at your leisure. At this time, do you have any questions?
Looks like there's one in the chat so far. And I just wanted to point out from the last slide that Torri showed, in the middle of it was the National Radon Program Services. And that information is up on our Radon Program website too. And that program is housed at Kansas State University, and they pretty much handle all the radon expertise for EPA. So they are also a resource. They have a helpline, and they also provide test kits. So for instance, if someone was interested in getting a test kit from us, and we weren't able to send one out right away, and they kind of didn't want to wait, that is one source where you can get a discounted test kit. They run $15 from the National Radon Program. And when I have questions, I go to them. So that is just another resource for folks for radon questions and for radon testing kits and so forth. And the one question I'm seeing on the chat, if a builder of new home is already installing a passive system as part of the home, would they still be required to test prior to selling the home to a new homeowner? And in South Carolina, there are no requirements regarding radon. Well, I guess there are two. There is a requirement to disclose a radon issue if you know about it in a home. And in Greenville County, there is a requirement to install a passive system. What we recommend for a passive system is that that homeowner, when they purchase the home, that they test. But the builder is not required to test it. And there is actually no testing that is required in South Carolina, but it's protective for health, and it's something that that we certainly recommend. And I think more and more homeowners are aware of that issue. We get a lot of calls about it. We distribute a lot of tests, and we have a number of professionals in South Carolina, particularly doing mitigation, but also measurement work. And the measurement work is normally associated with real estate. So I think I've answered that question.
Did you answer both, Leslie? That was one in the question and answer that says, can we get a copy of the slides? There's also there's a such thing as a radon system that a homeowner can have installed in an older home.
Oh, absolutely. Yes. The picture that we showed, it's just the best picture there is available. And the picture we showed was in a new construction home, but that same type of system can be installed in any home. And most of the systems in South Carolina have been installed into pre-existing homes. So, and that would be especially the second picture that showed the pipe going up the outside of the house. That is often going to be a very reasonable and cost-effective way to put a system in an existing home, is to run the pipe up the outside instead of up through the middle of the house. So there are a lot of different techniques used, such as that one, but going by the standards, and the standards are really the latest word on how a house should be mitigated. And the important thing is to follow those.
Okay, thank you so much. The next question, thanks so much for the presentation. Can we get a copy of the presentation and resource links? Yes, we will. I'm sure, I think Michael discussed that he would be able to, we will be able to keep this presentation live on the website for some time, but we also, he can also share the presentation of the PowerPoint to you all. The next question, when my buyers have a radon inspection prior to closing on a new build, are buyers required to correct the high radon before closing? They have said no.
They are not.
Got you.
And it is something that you cannot effectively test for it before you build. You really can't effectively test for it until you are occupying the home, and the home is kind of functioning in a normal way, and the HVAC system and all of that. Yeah, I think I was going to say something else, but I can't remember what it was.
Okay. The next question, Leslie, is do some states have more radon than others?
Absolutely. South Carolina is not too bad. In South Carolina, there's more of it in the upstate. Pennsylvania, parts of Pennsylvania might have the worst problem, and they have levels. EPA's action level is 4. There have been levels of 6,000 found, and there's nothing anywhere near that high in South Carolina that we found.
Okay.
There's a question about, is there radon gas in the low country? It is everywhere. If you go and look at the map we have of the testing that we've done in South Carolina, or that homeowners in South Carolina have done with the test through our program, you can see some little slivers of red in those little pie charts in the low country. So it's definitely something that you would want to look at anywhere. And like I said earlier, it's inexpensive to test, it's easy to test. So it's just a good thing to do. And you can't determine what one house's level is based on the county or based on other houses. It's really a matter of that house itself. It's an individual situation. And I say picocuries per liter. And so picocurie is a measurement of radioactive decay. And a picocurie is the equivalent of 2 radioactive decays per minute. So, and it is per liter. So it's like a 2-liter bottle of Coke or whatever. Picocuries per liter of air. So that means a level of 4 is about 8 radioactive decays per liter of air per minute. Now, I've heard people also say picocuries, so I'm not sure which one is correct, but I think either one is good.
Good. Okay, are there any other questions? Hold up, Leslie, one more. Thank you for a great presentation. Thank you, Kathy Harry. Here on this slide, our information. If you have other questions after today, you can contact Leslie, and and Michael stated earlier that the presentation will be provided throughout live or actually on their site. So there's Leslie's information, my director, our program director, Sonia Younger, and my information, Torri Toland. At this time, are there any other questions? Hearing none, we thank you so much. We would like to thank the South Carolina Association of Realtors and Michael Chris for his patience in working with Leslie and I. At this time, Michael, we'll turn it back over to you.
I see one more question.
I'm sorry. Okay.
How often is there a need to address mitigation again after repair? There might be a need, I guess, to do some resealing. The fan may need to be replaced, but it should just be small things like that. And now it is actually a good idea for people to retest their homes periodically that have tested at a low level, because things can change over time, especially if you've done some renovation. So it is a good idea to test periodically, and hopefully a mitigation system would not need work frequently, and the work would be minimal, such as fan replacement.
All right, thanks, Leslie, and thanks everyone for tuning in today. If you guys are looking for a recording of this webinar, we will be posting on our YouTube channel. So that's youtube.com/screaldoors, and that should be posted later today. So thanks everyone for joining us. Thanks, Leslie and Torri, and have a great day.
Thank you.
Thank you so much.